Welcome, everybody.
And everyone telling you be a
Welcome to Tenant Talk Live, everybody. Welcome. Welcome, everybody. Feel free to drop where you're joining us from in the chat. We have V who's just in the chat as well. Welcome, V. Hi, Claudia.
Hi.
Welcome, everybody. If you just joined, feel free to drop where you're joining us from in the chat. We have Marsh from Oregon. We have Kayla from NYHC joining us from Maryland. And again, hi Claudia joining us from Michigan.
Yeah.
What are you doing?
You're breaking up, Sid.
Oh, thank you for that. Sorry. Let me see if I can turn that. Are you able to hear me now?
Yeah.
Sound good?
Yes.
Awesome.
Yes.
Thank you. All right. We have Alexia joining us from California. Hi, Alexa. We have Zachary joining us from Michigan, Renee Williams from Ohio, Oliana from Idaho. Awesome. Welcome, everybody. Feel free to keep dropping where you're joining us from in the chat. Awesome. There's still people coming in, so we're going to give it another minute or so. But thanks again for hopping on for the last call of the year, everyone.
My love. My love.
Welcome, everybody. If you just joined, feel free to join or drop where you're joining us from in the chat. We have Chris joining us from California. Hello. Dr. Bambi joining us from Georgia, Austin from Minneapolis, and Susan from Los Angeles.
No, it's I just put a.
All right, everybody, I'm going to go ahead and get us started just because we have two guests today and I want to make sure we get through everyone. You're going to have to excuse me if I get a cough, but hopefully it goes away. It just started, but thank you, everybody. You can feel free to keep introducing yourselves in the chat. If you're new around here, this is Tenant Talk Live, and this is a place where we often get together at least once a month to kind of talk about different ways to get involved in federal housing policy so you can connect not just with NLHC, but also with one another. And I'll be helping moderate today's call. My name is Sid Betancourt, and I'll use she, they pronouns. And I'm a housing advocacy organizer with the coalition. So thanks again for being here. Before I bring on our guests for today, I do just want to give a couple of updates. First, if you are receiving NLHC emails, you should be getting one called The Connection. Probably, I don't think this Friday, but I'll make sure that when we re-up the connection again, we'll go ahead and have an update for you. But I do think we have one this Friday that'll give you all the recap materials, including the chat, including the recording and any links shared throughout this call so that you have. And Gabby just dropped the link to register for the chat. And then this is a very timely thing, but I'm going to share the community agreements on the screen, and one of them is making sure that you mute yourself if you're not speaking. Yourselves.
I'm depositing things in people's bank accounts. I just watched the TikTok.
Thank you so much. And then one of the other rules that we have is the platinum rule. So just treating others the way you want to be treated, or they want to be treated. So in other words, just please consider how others might want to be treated and how that might differ from yourself. You want to make sure that you're listening with an open mind and with empathy. And then our last one, if you've spoken already, make sure that you give others the opportunity. Awesome. So I'll go ahead and stop sharing that. And then the next Tenant Talk Live in January will actually be focused on going over those community agreements again and adding anything else that you all would like. So that'll be on January 8th. And then again, if you have any questions, feel free to drop them in the chat and we'll try to get through them before the end of the call. And again, just make sure that you stay muted if you're not currently speaking. And now I'll hand it over to our first guest. Today we have joining us, we have Charlotte Bruce from Children's HealthWatch, and we also have Shannon Nazworth from Ability Housing, and we'll go ahead and get started. With Charlotte, if you want to share a little bit about yourself, Charlotte, and I'll make sure to share my screen so that you can present.
Perfect. Thanks so much, Sid, and thank you everyone for welcoming me here tonight. It's really exciting to get to meet you all. I've heard a lot about this group, so looking forward to sharing some of our work. I work for a group called Children's Health Watch, which is a network of pediatricians headquartered at Boston Medical Center, but it's a national network of pediatricians in hospitals in Baltimore, in Philadelphia, in Little Rock, and in Minneapolis. And the work we do is really based on conversations we have with patients who are visiting either primary care clinics or emergency departments in these 5 hospitals, and then using that research and conversations to inform our advocacy work and really more broadly inform the hospital systems that we're embedded in and encouraging them to participate in the advocacy work as well, because health institutions have such a large voice in this work. And so today I'm going to be presenting about some of our both research as well as our interventions around housing in the healthcare setting. So excited to share some of that with you today. You can go forward. Perfect. So this slide, so when we think about housing and health, there are multiple components of stable housing, as I'm sure you all know. So there's not only just the stability in terms of having a place to stay and the affordability, having that the cost burden of that, but then also these pieces around quality of housing, around safety, and around neighborhoods. So things like access to public transportation, resources like grocery stores, schools, green spaces, and then also community support and that social aspect of what's around the neighborhood, and supports for families. All of these pieces tie together and come in different forms and affect health across the lifespan. So a lot of our research is around the connections between housing and things like birth weight and mental and behavioral health, child development, general health status, and also health services and usage. You can go forward. And so when we look at housing stability through sort of this health lens, we often think of it in terms of the home iceberg. So this slide has a couple of different pieces. If you click sort of that first iceberg, that the part that seems apparent or first presents itself when we see patients in our emergency department is often families who are experiencing homelessness. And then when we talk further with them and sort of get under that iceberg, there's the hidden homeless. So families who are, not necessarily in shelter, but who are on, staying on couches, staying with different families, but don't have that stability aspect of the housing. We also have, if you click again, housing insecurity is a term that we use often in our research, and that is really multiple components. So we have things like being behind on rent, overcrowding, having to move multiple times, and the impact that has on families' physical and mental health. And then at the bottom of that, we have one of the often roots of this experience is the unaffordable housing and really lack of affordable housing. So even, as you know, the long wait list for vouchers, and if you are able to secure a voucher, having that be in, you know, a neighborhood that's close to where you work or your communities, things like that. You can go forward. So when we talk about housing as health, we really think about it across the lifespan. So in the prenatal period, a lot of connections between preterm birth and low birth weight, stress of being unstably housed or housing unstable, and then also through early childhood. So a huge impact at the beginning of a child's life, at the first couple of years that are very critical for growth, for development. We can see developmental delays, as well as hospitalization risks. So we often have families coming in because they're experiencing homelessness. And then as you move through the lifespan, a lot of connections with educational outcomes, weight trajectory, other sorts of hardships related to financial resources, and then in adulthood, that continuing. And so as pediatricians and in the healthcare space, because of all of these health outcomes that are so costly, and this is sort of a screenshot of a study we did back in 2017 that just looked at Massachusetts and the cost that these different poor health outcomes have to the health system, looking at these and sort of bundling all this research together to really in our work, convince some of the hospitals and institutions to really invest in stable housing for their patients. So whether that is integrated care coordination in the hospital or referrals and sort of the warm handoffs with different agencies, as well as screening and intervention. It's over the past few years, I think, become a lot more commonplace in the institutions that we work on. And so this is one of the ways that we're able to sort of do that advocacy and convincing among the higher ups there. Go to the next slide. Getting that buy-in. And so, as I said, these are some of the ways that hospitals and healthcare, sort of the range of how they can get engaged. So some have research embedded in their institutions, like how Children's HealthWatch acts, do screening and some referrals. Some are even more integrated and sort of systems connected. So making sure that they're doing warm handoffs with their patients and following up, so that they're not just giving patients, you know, a bundle of resources or a referral to something that's going to put them on a wait list. And then at the larger level, getting much more involved in policy and advocacy and really investing their financial resources, as well as more of their advocacy teams in ensuring patients are able to access housing. Next slide. And so the program that I really want to talk about more today and share with you all is this program that we at Children's HealthWatch conducted a few years ago called the Housing Prescriptions. And so this was a pilot trial at Boston Medical Center amongst 76 families over a course of 4 years. And these are all patients at Boston Medical Center with at least one child who is under 11 years old, although often many of them had older children as well, and that they were experiencing one of these forms of housing instability, as well as cost burden, so paying a significant amount of their income on housing. And then the last criteria was at least one member of the family was medically complex. So we define that as a child or an adult with 3 or more emergency departments visits in the past year, or a child with medical condition that required 2 or more of our specialists to be seeing them regularly. And then we also limited it to Medicaid eligible patients, and as a way to really target families with lower incomes. And the reason that this program was so successful, and it was really community-based in terms of how we designed it, as well as relied very heavily on partnerships across different Massachusetts organizations and agencies. So we had buy-in from the health system at Boston Medical Center, our group, Children's HealthWatch, doing the research, but then really using the expertise and work that was already out there in the community. So with housing service agencies, medical legal partnerships, community development corporations, and then lastly, partnering with our state government at the local housing authority, so the Boston Housing Authority. And for this program, what we did is we paired families with a core care coordinator, excuse me, at Project Hope. And they really worked one-on-one with the families to create a housing plan together that was very individualized to that family's wants and needs, and then providing a combination of services between financial counseling, benefits and connection, legal services to families who were maybe dealing with things like eviction or back rent, and then the most important piece was priority access to public housing. So in Massachusetts is nationally, there are long waiting lists for families to actually receive housing vouchers or housing supports. And so we were able to partner with the local housing authority to provide these families with that sort of expedited service. And so when we, this was a 4-year intervention, we talked to families or did these sort of formal interviews at the beginning of the program and then every 6 months to understand both qualitatively how things were going for them, as well as look at some very specific data around healthcare usage, some screening around different social needs. And we found towards the end of the project that there was sort of unsurprisingly significantly greater improvements in child health status, as well as parent anxiety and depression for the families that were in this intervention group versus the ones who were just given that the standard of care, which was just resource referral. And we've been able to build on this success at Boston Medical Center to get more buy-in from our institution, as well as spread across Massachusetts, more hospitals being interested in supporting programs like this or interventions like this, family-focused interventions that really integrate health, housing, and social services in order to improve health outcomes for parents and children. So again, really supporting that care integration component, as we know that families, especially those with young kids, are oftentimes in very close contact with hospital and health systems, especially again in that first year of life when there are quite a few well-child visits. And so really ensuring that there's care integration at that hospital level and then connecting with these community partners across. And so we've been able to use this research in this particular study for a lot of our federal advocacy and state advocacy work around care integration, so supporting financially, there being offices and more staff on site to be able to assist families, as well as the larger and sort of broader, more housing policy work that we do with NLIHC.
Awesome. Thank you so much, Charlotte. And that sounds amazing. And we'll make sure to make some space at the end of the call for questions as well. I did see a few folks hopping on and using the AI feature, and I know it can be really helpful, and I really hate to take that away from some folks that might need it, but we do record these calls. We put them on YouTube too, so you can see them later, but we just want to make sure that folks aren't getting a lot of emails to like their private emails or the emails that they registered for. So please make sure to not sign up using that if you're able to, and if you have any issues, feel free to email me after the call too, and I'll drop my email in the chat. But I just want to say that before we move forward. But thank you, you guys. Okay, so now we're gonna go ahead and move forward with our second speaker for today. We have Shannon Nazworth joining us from Ability Housing. I'm gonna go ahead and prep that presentation, but Shannon, if you want to go ahead and introduce yourself for today, and I'll have that set up for you in a second.
Okay, thanks so much. I really appreciate it. And hi, everybody. I'm very excited to be here and meeting with you guys today. Really thrilled that you all get together this routinely. I think what you guys do is amazing. And what the coalition does to support everyone is truly remarkable. And I'm just glad that you have a little bit of interest. I'm Shannon Nazworth, President and CEO of Ability Housing. We are a Florida-based nonprofit affordable housing developer. And I think my slides are, yep. And if you can go to the next slide. Okay, there you see. Our mission is to build flourishing communities where everyone has a home. And our vision is a society where housing is a right, not a privilege, and all individuals have safe, affordable housing in vibrant communities. You'll see home and community in both of those. They are equally important. What we do is develop and provide affordable rental housing, but we do it for the benefit of the people living in our properties and the communities in which they're located. So to us, the housing is the means to the ends. It's the impact we're having on our residents and their neighbors. That is the most important aspect of what we're doing. Next slide. So this is the things that Ability Housing does. We develop housing. We're a housing developer. But we are creating community assets. As a nonprofit, we really are interested in retaining ownership of the property and keeping it affordable in perpetuity. That's our mission. That's our objective. It's the sole reason we exist. We also strive to implement property management best practices. Can you go back? Thanks.
Sorry, it moved.
No worries. Don't worry at all. Because we really want our properties operated with a sense of respect and opportunity for the residents. We want it to be a springboard for their success, however their family chooses to define success. But we do also provide very resident service-rich properties. We have a focus on serving individuals and families that have experienced homelessness, including the chronically homeless. So we do have individualized wraparound support services for anyone who was formerly chronically homeless or has other barriers that requires that level of support to be successful in maintaining their housing. They are voluntary, but they are also available to anyone. Whether they're formerly homeless or not, if you're having a problem, you're having a crisis, your kid's driving you nuts and you need help getting a resource form, whatever it might be, all of our on-site staff are available to anyone. But we do focus on providing the permanent supportive housing for the formerly chronically homeless and others with similar barriers who wouldn't meet the definition of chronic homelessness. And then we also work with neighborhood groups on neighborhood revitalization. We are an active member of every neighborhood in which we have a property. And some of our properties were specifically part of neighborhood visions for their revitalization, and we were a partner with those organizations. Next slide. So this is just a quick snapshot. This is who we are. And we have 5 projects in pre-development right now. We closed on one of them on Friday, so we're very excited, going to start construction soon. One of them, we've actually purchased the property. It's an existing senior property here in Jacksonville, Florida. That's Duval County. But we are going to be rehabbing it, so we include it in our pipeline of projects. We have 2 others in Jacksonville that we will be doing. Both will have at least some of the units set aside for persons exiting homelessness, including those who are chronically homeless. And one of them is part of a state pilot trying to link the housing resources with the support service dollars for persons who do not meet the definition of chronic homelessness, but are high utilizers of our behavioral health system. Pinellas County is the St. Petersburg area. We're partnering with another nonprofit to develop a property focusing on homeless veterans, but not limited to that. And then St. Johns County is just south of Jacksonville. It is our first property there. That is the one we just closed on Friday, and we'll be having the groundbreaking next month. So we're super excited. And just a few pretty pictures of our properties. Next. These are the things we offer, and I'm not going to go through all of them by any stretch of the imagination. You can have copies of these slides if you want information on any of this. We're very happy to do it. You can just see some of the support services that we offer. These are the more intensive, individualized services. And then we also have on-site services and programs. One of the things we were able to do that was really wonderful is open a free year-round Montessori preschool for both our residents and the neighbors, the residents in the neighborhood. At co-locating at one of our properties. That is a new thing, and it's a new partnership with a national nonprofit that we intend to replicate. And then we also work with federal FQHCs, federally qualified health clinics, to have services on site. So usually we're close enough to one of their clinics that we don't need to replicate anything. We're just a satellite clinic, or it might also be mobile services. You know, they have a mobile van or bus that they bring to the property so that people can access. In addition to healthcare, we're very focused on helping residents achieve their potential. So we work with other nonprofits for employability, education, you name it. We will help a resident. If their goal is to open a business, we'll find what is the organization that can take that entrepreneurial spirit and help them learn how to start a business, whatever it may be. Next slide. And this is just a snapshot of 2022. We're gathering our information for 2023. As you can see, 97% of our residents retained stable housing. And that's even though we are focusing very heavily on persons who are exiting chronic homelessness with the highest barriers. So a 97% housing stability rate is quite significant. HUD's benchmark is 85%. Of our residents, 768 had been homeless and 488 had been chronically homeless. So a very significant portion of our households had been chronically homeless when they moved in. Through our work, we were able to help them increase their household income and also help them access health care, both whether it's getting benefits that they're eligible for but aren't currently enrolled, or just literal physical access to healthcare and helping them navigate those systems. Next one. And this is the outcome of a pilot that we did, and I just wanted to share it with you. A few years ago, we worked with several of the state agencies, the Housing Finance Authority, our Medicaid agency, our Health and Human Services agency, others, to document for Florida the cost savings of doing permanent supportive housing for chronically homeless individuals. And this is the outcomes from our pilot site. There were 3 sites that were selected competitively. One was here in Jacksonville, one was in Miami, and one was in the Pinellas, St. Petersburg area. And as you can see, it is significantly less expensive to provide permanent supportive housing, including the cost of the housing and services, than it is to maintain homelessness for individuals. We had an almost 60% reduction in healthcare costs. The majority of those healthcare cost reductions were definitely in hospital services, not the ER as people seem to think. But the individuals we're serving have very complex medical needs, and they end up in the hospital a lot. They do enter through the emergency room, but they're not staying there. They get admitted to the hospital and then are released back to homelessness because they don't have a place to go. And then, of course, our sheriff's office was very pleased. Our sheriff does not want to be arresting our way out of homelessness. He thinks that's a waste of time and resources. But he does have to enforce the law. So once we get them into housing, he's much happier to not have to arrest people for silly misdemeanor expenses. Next slide. And so overall, for Jacksonville and the state of Florida, it was 30% less expensive, including the cost of the housing and services, to provide people with a permanent place to live than it had been to maintain their homelessness. This is a pre-post housing comparison. Whatever their move-in date, we took all of the cost of the publicly funded services for the 2 years prior to that date and compared it to the 2 years after that date. And this was the outcome. We saw very significant cost reductions. And for me personally, more importantly, we also saw very positive impacts on the individuals. We got them access to healthcare. We got them access to benefits. We were able to increase their income. The average monthly increase was several $100s that we were able to help people access resources for. We were also, their quality of life obviously was much better, not being homeless, but also having access to primary and behavioral health care for the first time in a very long time from a stable, more preventative maintenance perspective than only being in the healthcare system from a crisis perspective. These services are really instrumental in why all of our residents are thriving in the way that they are, especially during the COVID pandemic. Many of our residents lost their jobs. We're in Florida, and we have many properties in the Orlando market. Many of our residents work at the parks, and all those parks closed overnight for a very long period of time. We had just opened a property in Orlando that was over half of the units set aside for people exiting homelessness. We opened in December of 2019. By March, the world was shutting down. Disney and Universal and all were closing up shop, and everybody was without a job. And we were able to just meet with the residents and tell them it's going to be okay. I don't know what this is, and I don't know what we're going to do. You do what you can, you access what resources you can, and we'll meet you where you're at, and you're not going to lose your housing. The kids are not going to be living in a car. It's going to be okay. We'll figure this out. And through our partnerships and our relationships, we were able to navigate until the federal programs kicked in, and then we were able to help the residents access those programs so that they had the stability and surety of those programs. That type of relationship, that type of partnership with the residents is really the reason we exist. Again, the housing is the tool. It is the residents and the impacts we're having on the community and the residents themselves. Our goal over time is to figure out how we can help provide partnerships and resources to our residents so that the children growing up in our housing won't need our housing as adults. Now, of course, that's going to be a long experiment, and we won't know if we're successful till long after I'm gone from mobility housing. but we really are trying to work with the residents and have them lead that conversation of what are the things, what are the barriers, what can we do? You know, many of our residents have experienced homelessness. Almost all, if not all, have experienced housing instability at minimum. And, you know, we want to make it so that their children aren't facing those same challenges, but also recognizing we can't fix everything in the world. So we're just working with them for them to lead this conversation with us on what are things we might be able to bring to the table that would provide that safety net for individuals that may be turning down opportunities, because if they get that raise, they're going to lose the childcare. And so they take 25 cents more an hour and lose $1,000 a month subsidy on childcare, and their household just lost a lot of income. You know, what are ways we can work to help address those types of barriers as the landlord and somebody who has a relationship with these residents? So that is what we have here at Ability Housing. You can go to the next slide, and I will end now so that we have plenty of time for questions. And I really appreciate you guys having me on.
Amazing. Thank you so much, Shannon, and thank you, Charlotte. We'll go ahead and start taking some questions now, and I did see some in the chat. So if folks want to, you know, start getting in line and raising their hands for coming off mute, I'll go through some of the ones that were in the chat that we can highlight. Give me just a second because I wrote them down on the side for myself. So we did have one from Michelle Papas earlier, and I think this was in regard to the project that you were talking about, Charlotte. And just asking a little bit more about how this impacted the immigrant community that you were working with, especially because, you know, there's like that fear that folks don't want to interact with systems. And there's also the language barriers as well. So if you can speak on that a little bit, and Shannon, feel free to also answer that question if you want.
Yeah, so that's definitely an issue that we've come up against a lot, especially during the time frame of that project that I shared about was between 2016 and 2020. So at a time where there was a lot of extra fear around immigration because of a lot of policies that were going on at that time. So we heard a lot from our families, sort of the fear of using not just the hospital and institution, but also some of the benefits that we could connect them with, or, you know, even benefits that they were eligible for, feeling scared that it could somehow impact their immigration status. And then with the language piece as well, we are lucky at Boston Medical Center. We have a really diverse team of staff that is very, has a lot of language capacity and is able to make those sorts of connections. So for this particular project, it didn't come up as much of an issue. Also, one of the partner groups that we partnered with was specifically an immigrant serving network. So that was very intentional. But in terms of what we see at the hospital, we definitely see that issue come up quite often, as well as, you know, from our housing agency partners and others in the housing space.
Awesome. Thank you, Charlotte. Shannon, did you have anything to add?
I mean, I would say for us, the immigration issue is a real issue. We are in Florida. There's some interesting laws that have been passed at the state level that, you know, just institute a great deal of legitimate fear. And so, and there are some federal programs that, you know, fund our housing that require certain things. So we just try to navigate that as best we can, being as lenient while being within the boundaries of the law, but also recognizing sometimes it's more important not to ask the question because people are fearful. Why are you asking me that question? Who's going to come and ask for that information after the fact? And so we kind of are recognizing we may have conversations, but we don't need to document everything. And so that they feel comfortable that they can talk with us, but they don't have to worry that somebody from the state is going to come in and ask for all of the people who meet XYZ criteria or something like that.
Yeah. Yeah, and I know that earlier this year too, like a lot of folks like migrated out of Florida too. So I was interested in hearing like your perspective on that as well.
It's pretty bad.
Yeah, it is. It's a very dystopian time, I think. But I know Claudia, you have your hand up and you left a couple of comments in the chat as well. I don't know if you want to ask them live, but I know we always want to replicate the work and bringing it to Michigan. I don't know, Shannon, if you would have the capability of bringing it to Michigan, but Claudia, go ahead. Oh, you're muted, Claudia.
Yeah, that would help Michigan because we're such a, the developers build luxury apartments, and these city planners go along with these developers for luxury apartments. And if you could come to a city call meeting or a city council meeting and present the program, and even to our Michigan State Housing Development Authority people in Lansing, I think they would latch on to it because we've got a 5-year housing plan that's sitting stagnant right now. And so we really need somebody to really come in and say, hey, look, this is the program. How can we implement it here for you guys, you know?
I'm happy to share
So,
information. I'm also on the board of the State Supportive Housing Coalition, and that's where we got a lot of push. We were able to impact state policies with regards to affordable and supportive housing as a coalition, and I'm happy to share that kind of information as well.
Awesome. Thank you, Shannon. And we'll make sure to include that in our connection recap email too, so folks have access to that. Okay. So before I go to Renee Williams, there was a question from Jennifer Mohawk just asking in terms of, I think it was your presentation, Shannon, when you were talking about the criminal justice aspect. Does having a conviction on record play into this? Most I always struggle with that word, but most
Recidivism.
yeah, thank you, have found that if an ex-officer hasn't recidivated within 7 years after release, they're no more likely to commit future crimes than people who have never been convicted, but many landlords seem to ignore this. I don't know, Jennifer, if you wanted to come off mute and share a little bit more before Shannon answers.
Well, what I will say, if she does want to come off, that's great, is again, through the Supportive Housing Coalition, we were actually, yes, criminal records are a big barrier. Credit backgrounds are a big barrier. We all know what the big barriers are. You know, our mission is to screen in. We work real hard to, somebody's got to really have some issues for us to screen them out of our housing. But, and, you know, if they're registered pedophile and we have children on the property, yes, that would bar them. But for most people, by state law, because they wouldn't be permitted to live at the property. But, you know, we don't hold those things against people. One thing that we were able to do from a policy standpoint is work with our State Housing Finance Authority, and they instituted criteria recognizing that people were being screened out. We had done a lot of work to get units for extremely low income households and then have some of those set aside for persons with special needs and exiting homelessness. And people weren't able to get in because of the screening criteria. So they actually worked with a large stakeholder group, including property managers and developers, but also advocates, and created some screening criteria that to accept their funds, you had to agree that for the extremely low income households, this is the criteria you will use. It's a reducing barriers criteria. And property managers tend to just use one criteria for everyone. So it really started having much lower barriers required, and they have to document during monitoring that they are not screening out for these things. So, you know, sometimes if you can work the administrative side of it, sometimes without laws, you can get changes.
Thank you, Shannon. Yeah, I was like, we can share that too. I don't know if you can share that.
Yeah, if
I
you
think it
remind
would
me, I'd be very happy to send you the document. It's up, it's
Yeah.
on the Florida Housing Finance website. Yeah, absolutely.
Okay. Yeah, that would be awesome. Thank you. So Renee did have her hand up, and then I'll go to Ramona's question in the chat afterwards.
Hi, this question is for Shannon. So I was wondering, like, how did you push for the funding to get these services that coincide with the permanent supportive housing? Because like in Ohio, like our funding for supportive housing, permanent supportive housing is on hold. Um, and there's just not enough affordable housing in the Cuyahoga County. That's where I'm from, Cleveland. And I'm just wondering, like, how, I mean, because it's wonderful, the program that you're doing. So how did you push for that? How did you advocate to get like funding? Because that's something like we desperately need here in Ohio.
So, as I mentioned, I'm on the board of what's called the Florida Supportive Housing Coalition, and it's been around for many, many years now. And it is a broad group of primarily the state organizations that represent the service providers. So the community mental health centers, the alcohol and drug abuse service organizations called FADA, Florida Association of Alcohol and Drug Services or whatever, the Homeless Coalition, some supportive housing providers like myself. We only have a couple in the state, but we're on there. Some local governments might be on there. Disability Rights Florida, a myriad of various stakeholders, the vast majority of whom will never develop or provide housing, but they're serving the people who need the housing. Excuse me. And we've been working for, well, let's see, the first thing we did was Florida has state trust fund dollars for affordable housing. The first thing we were able to do was to get the legislature to require that the number of units for homeless households be counted as part of the rental market need. And that dictates what percentage of those state trust fund dollars must go to create housing for persons who are homeless. It's a proportional thing. So if 10% of the housing need is identified as homeless, 10% of the state trust fund dollars have to go to housing for the homeless. We then got them to add a state definition for persons with special needs. For us, we went with persons with a disabling condition, youth aging out of foster care, and survivors of domestic violence. Because the homeless were already covered, we did not include them. And that percentage need. So at this point in time, I think about 25% of our state trust fund dollars have to go to supportive housing for homeless and special needs households. And that was all legislative. But also while doing that, we spent a heck of a lot of time attending public workshops by our State Housing Finance Authority, really, really harassing them about doing more than only serving and creating housing for 60% AMI households. And we were successful, and it took persistence, and it took coming up and showing, and then the next year showing up again, and they realized this wasn't a flash in the pan, they're not going to go away. And understanding the program and really understanding what you were advocating for and providing specific recommendations, not just demanding do this, but telling them how they could do it in ways that could protect them, because their bosses are politicians and developers are pretty influential people, especially in the state of Florida. And through that, we were able to get them to create the ELI set-asides and then what they call the link units, for some of those ELI units being for special needs and homeless. And then we did the pilot. And one of the findings from the pilot that we were able to get them to be the lead on was there is no linkage of service dollars and housing resources. We're committing to provide supportive housing, and there's no guarantee of service dollars in any way, shape, or form. We're very blessed in Florida that our housing agency has gotten out in front of our service organizations, to be honest, and is putting money towards creating the housing, but there wasn't any dollars for the services. And so we were able to, Florida is a small government state, so rather than have employees, they just contract everything out. So the behavioral health contracts are farmed out by region to entities that they call managing entities. So there's 7 regions around the state. These managing entities are contracted by our state to administer behavioral health dollars, service dollars. We, the Supportive Housing Coalition and Ability Housing, had a great relationship with our managing entity in the Jacksonville region. And we really taught them how they could approach Florida housing and ask to have their service dollars linked to the housing so that the people they were serving could access the resources. And so it was by helping them be a new stakeholder in the conversation and having them advocate directly with the state, because they know their people need the housing. And it was really just a lot of time, a lot of effort, and a lot of meetings, and a lot more meetings, and then a lot more meetings. I don't know if I answered your question, but that's how we got.
No, thank you. And I was wondering, maybe if sometime in the new year, if I can reach out to you so we can maybe talk about this more, that would be greatly appreciated.
Sure thing.
Okay, thank you.
Awesome. Thank you, Renee, and thank you, Shannon. Persistence is key, and I think we talk about that a lot too, but it's really nice when you get to show like the product for it afterwards, or like the outcome of it.
And let's be honest, we can pull it off in Florida. Let's be honest.
Chris in the chat put developers are influential in Florida. Seems a pretty strong understatement. Somebody laughed at it too. I'll pass it over to Ramona. Ramona, if you want to ask your question out loud. And then I skipped somebody and I'll go back to them, but they were asking about seniors that are experiencing homelessness. But Ramona, go ahead.
Hi, everyone. I'm actually like super sick, so I sound totally different.
Ramona.
I was listening to the
Hey, Ramona.
description of like the program and how it serves folks. And it really sounds like what public housing is when it's fully funded. In addition, like public housing would give you, locking your rent to your income sources. So there wouldn't be a fear of eviction if income changed. So I was wondering if the coalition that has been mentioned, or like if the speakers ever collaborate with groups that are working to expand and rehabilitate public housing.
So what I can say for ability housing, we work with our local housing authorities in the communities where we own and operate properties. And of course, we always accept anybody with a voucher. From a coalition perspective, Florida's housing authorities are all distinct, separate, entities around the state. It's a very large state. Some communities have embraced being part of the conversations about, how we help people that are most vulnerable. Others are very resistant. And with regards to, recapitalizing, whether it's they're doing the RAD program or whatever it is they may be doing, we don't directly do that. Although we have helped some housing authorities find other organizations to partner with them to help them with those complex finance structures. But it is, and housing authorities are very different. I'll be really honest. Florida's a big state. Some of them are really, really awesome and just doing amazing things. And some of them, not so much.
Yeah, and I know Ramona does a lot of advocacy in that space too, so it can be a growing movement, and hopefully we can get some folks to participate from Florida. So the question that I skipped was what is being done for seniors who are homeless. And I know some of the work that y'all might do is intersectional and will include that, but Charlotte and Shannon, if you want to speak a little bit about that.
Charlotte, you want to?
Yeah.
Truthfully, I work specifically with children. I don't actually know the answer to that question. I can't confidently share on it.
Okay.
No, that's
Sorry.
completely okay. I know.
That's
I was like,
totally
I know.
cool. So unfortunately, homelessness among seniors is the fastest growing population. It's really, really a crisis for the country and in Florida. I also chair the state's council on homelessness, so we've been talking a lot with our Department of Elder Affairs and our area agencies on aging. It's a real problem, and we're trying to figure out ways we can make sure we're designing housing that is better for aging in place so that seniors, once they find housing, can age in place and stay. And then, of course, most of them are on very fixed incomes. And so we're going to need deep affordability to assist the individuals. It is a different experience. Many, unfortunately, that are becoming homeless now have never been in the system, have not experienced homelessness in the past. So the trauma is very real. They never thought they'd be in this situation. There was a time when the number one predictor of homelessness was prior experience of homelessness, but with our seniors, we're seeing a great number who have not been homeless before. And I think we're just all collectively trying to figure out how we find them, identify them, help them understand how to access resources, help them understand that it's okay, that you don't have to be ashamed. And then of course the housing is the biggest issue, and we wish we had more.
And there's also the intersectionality too of the seniors being held hostage in their homes.
There's intersectionalities on many levels, unfortunately, and Florida, many of the seniors are living in houses that aren't suitable. They're not homeless, but the houses are really not safe homes, and so that's not something that we personally tackle at Ability Housing. But we are partner with other organizations, especially around the neighborhood revitalization, to help people who are in really deplorable conditions, either figure out how to fix up their house or get them into something else so that they're safe, because there are people in really inappropriate housing right now.
Yes, indeed.
Thank you, Julian. Did you want to ask a question, or was it just that comment?
No, it was just that comment. It's just that comment because people neglect to see how all of that works together, and that's one of the things that I've been speaking to here in Minnesota. And I sometimes jokingly say that I serve as a twofer in that I am a pretty good doing 74-year-old senior, and so I'm a young elder, if you will. But that we've got to get more of our elders involved as well.
Oh, yes. And I appreciate you bringing that up, Julian. Thank you. And all the hard work that you're doing too. Okay, so I had a few questions from Rachel in the chat as well. I think that was like the last question I saw, but we want to make sure that folks are still asking questions until the time is up. So if you have one, feel free to raise your hand. But Rachel, go ahead. Oh, excuse me.
Okay, so yeah, I was wondering, like, with this process, because I noticed with my housing advocacy, lots of times people go in and they're denied house, or even to be allowed to apply based on the 3 times the rent rule. And so with a lot of these tenants who are like in housing, I know that that should be 3 times their portion. And I'm wondering, are they doing anything about that? That's number one, so that these tenants with Section 8 vouchers can get into these the supportive housing that you guys have, affordable housing. That was one question. Let me check the other. But that was my main thing, like who's overseeing these processes. And another thing, like in Pompano Beach, I found out from one of the affordable housing property managers is that they they're designating like agencies to start the wait list way before the property has been built. Have you seen this happening throughout the state?
So on the 3 times income, if they're funded with the Florida housing, that is one of the barriers that they said they cannot do 3 times the rent. It has to be based upon their portion of the rent. So again, that's only if they're funded through that program. It is overseen by Florida Housing Finance Corporation, and it's part of the monitoring that every property goes through on whatever routine basis that it goes through. Other than that, these are private landlords with private options, and they're not breaking the law, so they have the choice to select whatever criteria they want, provided it doesn't violate fair housing laws or ADA. With regards to, I'm sorry, what was the second half of your question? I apologize.
I was asking about like the oversight and the fact that, like, I noticed that some agencies, before the properties are being built, the agency is starting a wait list and no one really knows about that agency. A property manager in Pompano Beach told us that we needed to take some of the tenants that need housing to that agency, but I'm wondering how how have you seen that? And then if so, like how are these types of systems being put in place? Like, I don't think that's like really fair, especially when people don't even know about it. So these other agencies. So I was just wondering, do you know anything about that?
The only thing if it's a property manager from a Florida Housing Finance funded property, and they have to have those link units where they're making some of the ELI units available for persons with special needs and the homeless, if that's the scenario, and it sounds like maybe it is, what Florida Housing did was any nonprofit can call Florida Housing and ask to become what they call a referral agency. They have to be a service provider that is referring people to those link units. Florida Housing is coming from a compliance standpoint of they want to make sure that if the landlord is saying the persons with special needs are in these units, that they're coming from a qualified service organization that is referring people who actually need the housing, and it's not some sort of shell game with the landlord. So any organization can approach Florida Housing and ask to be put on that list, and there's a process, and I couldn't begin to tell you what it is, but they basically just verify you're legit. And then the link units have to come through one of those referral agencies. So that is the only thing I can possibly think of. But if they haven't even started lease up yet, it's a little early to be going there. So, you know, I don't know. Other than that, I don't know of any programs or anything like that.
Okay. Okay, thank you.
Sure.
Thank you, Rachel, and thank you, Shannon. Mrs. B, and I think that'll be our last question for today, and then we'll wrap up.
Thank you, Sid. Thank you, Ms. Nazworth, for your insight and sharing your knowledge with us. I would like to know, have you had any experience with a third-party regulator in that the third party sets the rents for the area, for the town, for the city? For example, they might decide today that the rent for a one-bedroom apartment is $3,100. And then tomorrow it's $2,600. And so when that occurs, it creates a problem for the housing authorities, because if they have a standard of $2,500 for one bedroom, then the Section 8 voucher holder, has to apply for an exception. And oftentimes, you know, they don't get it. So I was wondering if you had any experience with a third-party regulator, because these corporate landlords have become so lazy that they do not wish to interact. You have to go to a portal and to apply, and it's a third-party regulator who decides whether or not you're qualified.
So I personally, we don't use that methodology for our housing. I do know there is a lot of standardization in the application process, which is highly problematic on a myriad of levels. And people just get bumped out without any conversation about, you know, what's the unique circumstance around your life history that, you know, you have this credit blemish or whatever it may be. And so I do know that those happen. As for third-party regulators setting the rent, I mean, landlords can set the rent, if that's what you mean. They just decide what the rent is, and they will charge as much as the market will bear. And you know, I'm in Florida. We had the highest year-over-year rent increases during COVID. I mean, hundreds and hundreds of dollars overnight, with investors coming in and buying up a lot of stock, and up in the rents $500 with no notice. It's a real issue across the country, but Florida just happened to be one of the states that was really prime hit by that. And it's a free market. I'm not saying it's right. I'm just saying they have the right. Having the right and it being right are not always the same thing. But you know, it's the free market, and Florida is a very landlord friendly state, to put it mildly. So, you know, they're not going to infringe upon their abilities to set the rate as what they believe the market will bear.
Well, unfortunately, you know, that's not the situation in some parts of California. But my other concern is, do you have rent stabilized apartments there in Florida?
All we have the Section 8, you know, whether it's PHA owned or have contracts with private owners. And then we have the majority of our affordable rental is funded through the low-income housing tax credit program. So it is income restricted and a maximum rent restricted, but it is not something where the amount it can increase is limited or anything like that. Florida, again, is a very landlord-centric state.
Well, the reason why I ask is because New York City, for example, has rent stabilized apartments. And the problem is, if it's in a high tech development and the rent stabilized tenants create a lot of problems, when a unit becomes vacant, the corporate landlords are not filling those apartments. They're leaving them vacant. And also the city gives them X number of dollars after X number of years for a vacant apartment. So it's a real concern. And I didn't know if there were any other municipalities that are on this call that have rent stabilized apartments with this type of provision?
I am not familiar with anything in Florida remotely like that.
Okay. Thank you. I appreciate you and your time.
Thank you.
You're most welcome.
Thank you, Mrs. B. And again, we're at the hour now, so I'll go ahead and let y'all go. I'll just ask our speakers to just stay a second after I finish recording for a quick question. But thank you again, everybody, for joining us for our last Tenant Talk Live of 2023. As always, if you have any questions for me, my email will be dropped in the chat for y'all, so you have that. Our next Tenant Talk Live of the year won't be on January 1st because that's the new year, New Year's Day. So it's going to be on January 8th, 2024 at 6 p.m. Eastern time. And again, we'll be focusing on just hashing out our community agreements for the year. And as always, we're always looking for guest blog post authors. If you're interested in that, you can email outreach@nlhc.org. And don't forget to join our Facebook page to stay connected. And I just wish everybody a happy holiday season. Stay safe and protect one another, and feel free to email us if you have any questions. But yeah, thank you, and see you in the new year.
Merry Christmas, Happy Kwanzaa, Happy Hanukkah, Happy New Year.
Thank you, Mrs. B.
Happy holiday.
I love y'all. Safe travel, safe journey.